Okay, so this is our first meeting. Like I said, this is an open forum and it's pretty much an introduction one. So if you've got something you've learned that you want to share or advice that you want to give, by all means, feel free to do so. If you have math problems you want to go over, I have, hysterically enough, a whiteboard, which is still covered in, kid things. We can go over math. We can go over whatever you guys want, books, whatever you want. Any generic questions are fine. This is just the beginning, so of course we're going to get more into it as we go. And I'm going to hand the floor over to Letty because I know Letty had some stuff she wanted to say.
Hi guys. Okay, so I read chapter 9 on the acid-base balance stuff. I didn't read through the disorders. I actually kind of looked them up on YouTube through the Registered Nurse RN. She does a very good explanation and everything on it. So I did notice that how the body compensates comes up a lot. So I guess it would be important to know that. She does have a video on her tic-tac-toe method for figuring out if it's metabolic or respiratory acidosis and alkalosis. And then somebody in a Facebook group that I follow also posted a method. I'm not sure how to get it to share with everybody. So I'll have to find that out or try to find a way to explain it.
Is it on Facebook, Letty?
Yeah, so I don't know if you remember, I posted this thing in our nursing group. It was like Ababab or something like that. It had first name, last name. Wait, say again?
Sorry, I was just gonna say you can open up your Facebook and then do the screen share thing like we did for Clinic if you wanted to share it.
Oh yeah, that's right. Totally forgot about that. Thank you. Let me look it up right now.
You guys are going to have to teach me that talent because we did not learn that at all. Right. So, yeah.
Let me just get to
the bottom of the screen. There's a green square. It just says to share your screen. So I could click it and you would just see whatever's on my computer. So if you have some dirty background, you might want to pull that off, but you'll be able to share things or whatever.
Thank you so much, Jen. Literally, Richard Feynman and Arlene are in the background photo of my pictures on my computer because I'm such a dork, so it's fine.
Let me see if I can find the post before I expose my Facebook. All right.
Can y'all hear me okay?
Mm-hmm.
Yeah, it's a little bit quiet, but yeah, for the most part. So if we're like, what? That's what's going on.
Okay, I think I might get earphones so that way, because I would have to be really close.
That's okay, I can see better that way, so it's all good.
Where did it go?
You know what, Letty, while you're looking for that, I know, Sione, you said you were reading something about neuro stuff, right? And all that kind of stuff, that chapter. Did you want to share anything about that by any chance? And if
yeah, sure. Okay. Also, I wanted to let you all know that, when I talked to Professor Parkinson, she mentioned that it would be good to know hormones for Med-Surg 1. Yeah, because she said that's one of the tough parts of Med-Surg 1, and also the neuro chapter is also difficult. So actually, if you have Davis, did you buy the? Do all of you have the Med-Surg book?
I don't yet, actually.
Oh, okay. If you, because on the Davis FA Davis website, they do offer a discount. I don't know if they still do, but back when it was the first week or the second week of school, I got the one where it was with the maternal book, and then the Med-Surg book, and also the drug book together. And then there's a code. It's called the Davis Advantage, and then if you use that code in that book, it gives you the ebook, and also it gives you assignments that you can do where you watch a video and then you do like a pre-quiz, and then you watch a video, and then you do a post-quiz which tests your knowledge. And then yeah, so for the neuro chapter, okay, I'm gonna go to that. Actually, okay, so before I do that, so I did read about the cardiac chapter too, and something important that I feel like would be tested on is there's a safety alert when it comes to providing nitroglycerin in patients with coronary artery disease. So you have to make sure that they're not taking any sildenafil citrate, which is also called Viagra, because it can lower their blood pressure even more, because nitroglycerin is a vasodilator. So that would be important to know.
Absolutely.
Yeah.
Thank you for letting us know about that, for sure.
Yeah, you're welcome.
Do you have a good working to say what hormones specifically? Like, are we just talking
okay.
everything pituitary or reproductive or all of it?
So I didn't actually specify with her. She just said no, the hormones. Yeah.
But that makes a lot of sense, because the hormone cascade is a really big deal. And I'm so glad that you brought that up, because that's a total area I completely forgot about, to be completely honest with you. And then one of the things, just to tag onto that before I forget, I know Letty reminded me too. One of the things that we wanted to make sure that we stated was we all need to really make sure we go over the electrolytes again, and we have all of that down, you know, the highs and lows, because obviously it plays into every single other thing, including the EKGs. And I know, Letty, you wanted to talk about that. You probably have more to tag on to that as well. In the readings, when I listed out, there was so much there. I was like, God, if I list all this, you guys are going to kill me. So I sort of tried to just sort of target zone. But if you see stuff before and after and you're like, I think this pertains, oh, please do read it. You know, like if you think there's something else that's there, by all means read it. And I think you're right. The hormones are super important. And I think that's something that I didn't see on the syllabus, but I think you're 110% correct. And I know that it has to do with the hormone cascade, and do not ask me what that, I can't. Anybody remember exactly what that is? It's got to do with like the hypothalamus to the pituitary and some ADH in there, and then a whole big blast of hormones from there.
I have a really good, let me get the.
Yeah. By all means. And by the way, just so everybody's aware, we might have a 40-minute time limit. I know when I was doing Zooms with Noel and Cora, we got chopped off every 40 minutes. So I figured this session, 40 minutes is probably more than enough. Yeah, I'm sure. But like for next sessions, like if we need to do more, then just let me know and I'll just restart the thing.
Okay.
Sorry to let you guys know that. But yeah, they cut us off at 40 minutes. I'm like, no. Mid-speech, right? Does anybody else want to chime in while we're waiting for?
Oh, okay. I feel like also knowing the cranial nerves would be important. Like,
yes, I agree.
769. It's on that page. So number 1 is olfactory. So that is for smell. 2 is optic, and then it just tells you like what kinds of physical tests you should do to test that cranial nerve.
Oh, that's great. Is that in the Hoffman book?
Yeah.
Oh, thank you so much for letting me know that, because like I said, I haven't read them there yet, so that's really good to know. But I completely agree. I saw a lot of NCLEX stuff that had those kinds of questions.
Does anyone have the OB book?
Do I have the OB book?
Yeah.
What?
I haven't gotten it yet.
Tell me what that looks like. I don't.
Yeah, let me go
it.
grab it. You know what's so funny is I almost grabbed it before I sat down, and then I was like, no, I don't need that today. And then of course I do.
I can probably like scan it and post it. I don't know if you'll be able to like see it, but it has like a little flow chart of like when ADH is released and stuff in dehydration.
Okay.
Oh, awesome. That would be great. Thank you so much.
Yeah. So I
And
can.
here is can you guys see that from there? Or do I need
Yeah.
to
Yeah.
screen share? This is
Yeah.
the
Let me write it down really quick.
Yeah, this is it right here. This is the book. Do you need me to read the ISBN to you?
Yes.
Okay. So the ISBN is, let me get my glasses. Fortunately, I kept them behind my computer in case of need be. I have had the worst migraine ever, you guys. You're going to have to forgive me. It's like, you know, the first 2 weeks after you get done with class, it's like, forget it. Your brain's just done, you know? At least mine is. So 978-0-8036-6654-2. And you know what? Let me see if I can find the chat. I will type it into the chat for you. And I see that, Letty, you're ready to show the video whenever you're ready to go. By all means, feel free.
Okay, just waiting to let you guys finish.
Oh God, please interrupt any time, because you know what? This is a free for all. Go for it.
All right. Well, I'm gonna start sharing then, if that's okay with everybody.
Yes.
Yeah, sure.
Okay. Can you guys see this?
Yes.
Yes.
All right. So let me see if I can put.
A little hard to hear.
Yeah, I can't make it any louder, I think.
Oh, is that a video that we're watching right now?
Yeah.
You know what you can do? You know what you can do? If you can, I don't know. But if it's a video and it's linked to YouTube, once I just throw it up in the chat box, and then we can all snag it from there, I suppose.
It's actually not a YouTube video. It's a video uploaded to Facebook.
Oh, sorry. Okay. Yeah, I'm not a Facebook
Everyone's
expert.
in the Facebook ABC thing, right?
Yeah, they can see it.
Okay.
But basically, I'm going to give like a quick rundown of what it is, because I know you guys can't hear it. So basically what she's doing, she's taking these values and then she's going to put them in here. And then after putting them in here, she's going to determine if they're acidic or if they're basic, right? Or alkalotic.
I've heard of that.
And the first one that she's going to find is the pH, which is going to be the last name. And then she's going to match the pH, which is either A or B, with another A or B. And then after she matches it, the other one's going to be the first name. And that can be respiratory or metabolic. And that's just basically like a way to find out if it's respiratory or metabolic, acidosis, or alkalosis. So you can see right here, she already has 2 B's. And then this one's going to be acidic. And then right here, she's going to write what the pH is.
So basically, it's kind of an interesting little mnemonic way of remembering the difference between acidosis and alkalosis, from what I'm gathering. Am I right?
Just determining if it's either of these based on these 3 labs. So I like her method here, but I like the one from SimpleNursing better, because she actually kind of like goes into like the compensation. So she'll say, the body is compensating, or if the body is not compensating. So the book also gives the 3 examples. So it's no compensation, full compensation, or partially compensated. So I think those would be important to know how to determine. But yeah, I just wanted to show that to you guys in case, like, you look for another way to do things.
Letty, do you mind linking the YouTube video that Sarah, the registered nurse, uploaded on this?
Oh yeah,
It was just a little confusing because I couldn't hear the sound.
Yeah,
So,
sorry.
Explains it. No, that's okay. I appreciate you for putting that out there, though.
Yeah, thank you so much. And then I will totally second that. Sara at RegisteredNurseRN.com, I think is what it is, or whatever. But
yeah.
Okay, thanks. Every single person from our school, every single graduate, every single person on the face of the earth has pretty much said that that is the go-to source for a lot of understanding for Med-Surg 1, and I guess probably pretty much anything, that they say that is really, 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 really key. So it's a great supplemental thing for, if you want to get the extra video in. I don't know. Everybody has different learning modalities. I'm a terrible reader. I read slow, okay? I know I might be an English major, but God help us all, I am the slowest reader on the face of the earth. So if I can watch a video and someone can show me what goes where, it's a great day in the neighborhood. But that is the one thing I've heard over and over. What were some of the other ones, Letty? I know I said some
Picmonic.
Picmonic was one. Thank you. Yeah, Picmonic was cute. It's
funny.
Adorable. Yeah. There was what was the other one? Oh gosh, I wrote it down.
Nursing.com.
There's nursing.com.
I like nursing.com. It has really great cheat sheets. And the other one is SimpleNursing.
That's what it was. Thank you. SimpleNursing. Someone needs to be backup brain hard drives. You guys are saving me right now. I'm like, yeah, please.
I subscribed for Nursing SOS for the month. It's $39 a month, and she has like limited spaces. But like I like her stuff. What she has to offer. She does have good advice on how to study Med-Surg and pharmacology stuff. And she also has like kind of like little, I want to say, study guides kind of. But in terms of like, information, I think Sara RN has a lot more information on her videos and stuff. So
sorry.
Yeah.
I have a question.
Absolutely.
Because I don't have the Med-Surg book yet, what do you guys recommend that I start looking through? Meanwhile, I wait for the book to get here.
Do you have okay, I've got that right here.
You can start looking at the disorders.
The disorders.
Yeah, the ones that we just we're talking about right now for the acid-base balances.
Okay.
And then I think we're going to be coming up on cardiac, so you can look up stuff on EKGs.
Okay.
The anatomy and physiology of the heart. What else was on your list, Jack?
Well, what I was going to actually suggest, Carolina, how do you say Carolina or Carolina? How do you prefer?
Carolina.
Carolina, got it. Thank
you.
No, absolutely. I understand. Carolina, do you have the Nursing Care Plans book, and do you have Doenges by any slim chance?
I don't actually. I use the Davis Care Plan.
You know what?
Last semester.
I love this book. This book is great. It goes over, here, let me just open up one so I can show you.
Okay.
But I wanted to show you guys this, and I'm probably going to make like a separate video of it, but it goes into a bunch of stuff like, see if I can find it. Of course, we're limited on time. Here we go. So let's say, oh boy, what a lovely one to open up to. Men's health, sorry. But here we go. You've got this, and it goes over everything, like a quick summary about it. Now, there is one thing that you have as well that will also do this. And by the way, this book also continues on into diagnostic studies and to why you use these diagnostic studies. I'll post a video on this later just to save everybody time. And then it goes into the nursing diagnoses related to, as evidenced by, and then independent and collaborative plans of action. So it's a very efficient book. I love this book. You guys have no idea. But the one book that I will say will save your bacon faster than white on rice, if you want to get going with something, is this. As crazy as it sounds, you guys, this thing is a lifesaver. So if you're looking for something that's going to simplify things, get straight to the point, Kaplan's going to do that. And then if you kind of supplement that with the Registered Nurse RN Sara videos for Med-Surg for now, and then Letty's EKG stuff that she sent down, as well as you can always go back and look at, Carolina, do you have Karch?
Yes, I do.
Good. Karch is very important. It's exactly like the Med-Surg stuff. This is going to go right into all of it. It's pharmacology and drugs, but they also have chapters in there that are basically like the basic anatomy kind of stuff to give you that review about, like, say, for example, the cardiac system. And so that's why I listed all of those there. So you can go pick through those and find out what works for you and what works best. You can just skim it, see if you like it. If it doesn't work, don't use it. Only use what works for you. I know it's a lot of information. So like I said, I gave you guys as much as I could, but that's only if it works for you. It's only if it's helpful. Don't use it if it doesn't. So
can you go over how you're reading and using the Kaplan? Because I read it
sure.
kind of with what like chapters you gave and stuff. So I did chapter 3 and 9, and I struggled with comprehending it. Like, it was so shorthanded that it was almost like something I should have made, but I don't know how to utilize it.
Okay. Yep, then that's just a different type of learning modality. I completely understand. And for me, Kaplan made a lot of sense for me personally because it was just straight into the point, and it's like, okay, this is just going to be rote memorization, for lack of a better term, but an understanding of how to explain it if need be. Does that make sense, Jen?
Right.
So it's like, what's that?
Right.
Okay, I'm sorry. I couldn't hear too well. That's why I had to ask for a repeat. But how do you learn best specifically? And maybe I can direct you towards
probably the videos would be best, like Sarah's videos. Reading it is less effective as writing it for me. So I guess
that's,
I don't know what anybody else thinks, but
yeah. So would you say that you find, particularly for you, the nursing videos and then making your own care plans and your own practice kind of stuff more helpful than actually looking at, because Kaplan is pretty much a list. It's pretty much a bullet point. And that, unfortunately, I hate to say it, but Hoffman is very similar. So if you're looking for more details, I'd go and say review Taylor a little bit because it gave more fluff and it gave a little bit more of the sciencey stuff, as well as Karch. It gives a little bit more of that background and that meat if you're looking for that. But video-wise, the Sara RN, we all got that down. That one's a go-to, like, reliable source according to everybody. SimpleNursing, thank you, Letty, and everybody else for reminding me of that name. I was like, what is it? It's on the tip of my tongue. I've heard a lot of people love that. So go watch those. They might work for you. Oh yeah, they're already, and then Picmonics, like Sione said, is another one that works for a lot of people. And then nursing.com, I see that. Thank you for all those thank you, Jennifer, for typing them. I'm telling you what you've already typed. Let me not do that. I'm like, looking at the chat box. I'm like, hey, someone already wrote them. Oh, hey, look at you. I'm already telling you what you already know. So I guess my suggestion would be, I know rote memorization kind of stinks, but it seems like that's a lot of what goes on in this nursing program. Am I wrong? Or do you guys feel a lot of that is necessary?
Well, you should understand it more than just memorize it. Like, there are certain things that you should memorize, like lab values. But for fluid and electrolytes, you should understand it.
Oh, good grief.
Yeah.
I'm running out of time already. You're like, a gift from Zoom, running out of time? We've removed the 40-minute time limit on your group meeting. Oh, thank you. Okay, good. Well, glad they decided to give me a present. Anyway, we see you're actually using this for good purposes. Here, have an extra minute. Watch it be 1 minute. Anyways, sorry, guys. So whatever works for you, use it. And Sione is absolutely right. You want to absolutely understand why. But ultimately, at the end of the day, you want to do like that rocket scientist said, you want to be able to boil it down to the one pager, which I feel like Kaplan does, which is also what we do with the care plans, which is also what we do when we do the clinical worksheets. So the more that you do it yourself, the more hands-on you get with it, the more that you can say it out of your mouth. That's the best advice I can give, because it's like, then you know it. You know what I'm saying? If you can crank it out, then you know it. Because I mean, I could sit here. I'm honestly, when I started reading Hoffman, I was like, yes, I know this. And I'm like, great, let me go try to repeat that now. Because you know what I mean? You have to sort of, you kind of have to know, I hate to say it's not rote memorization, but you have to understand everything and you have to be able to remember everything. So that's more what I mean by rote. So you're going to have to forgive me for probably misusing that term. But does that make sense? So it's Hoffman's kind of a know everything kind of book. So almost every word is important, which stinks because it's a lot of words. But I'm pretty.
Oh, I want to show something actually.
Yeah,
if you don't
go
mind.
right ahead.
So when it comes to retaining information, I found the learning pyramid. I'll share my screen.
Thank you.
So you see. So okay. So yeah, for this, when you teach others, you retain 90% of the information.
Beautiful.
And if you practice by doing, it's 75%. So doing the skills lab, like going to the skills lab, is really helpful to retain the information. Then group discussion, like what we're doing, 50%. Demonstration, so what you see your teachers doing, 30%. Audiovisual, 20%. Reading, 10%. Lecture, only 5%.
And we all wonder why everything was so hard last semester.
Yeah, I totally
read this and die. Sorry, whoever was talking.
Yeah.
Sorry.
Yeah. So it's sorry, I just want to say one more thing. So it's really important to, when you like don't passively learn something, you should make it active.
Yes.
Yeah.
Agreed. Absolutely.
Yeah.
Agreed.
Mm-hmm.
Yes, and that's why I suggested the ornery worksheet stuff, and I said do as much as you want, do as little as you want. I know it sounds crazy, but that hands-on work, and then it'll make us faster, because if you look at that syllabus, there's like 4 of those that have to be done, and I'm like, holy moly, in 8 weeks,
I know.
all the tests every 2 weeks, my brain's gonna fall out and die. So I'm like, we got to get fast, and that means we got to know it, and we got to get used to doing it fast. And some of us are faster than others. I'm slow. So I'm gonna be working on my speed. Snail pace needs to pick up the race here over the summer. Okay, so
and by 4, you mean I saw 2 mini care plans and then 2 clinical worksheets, right?
Can you explain to me? Oh, for the semester, for the 8-week thing.
Yes.
Okay, from the syllabus, correct? Yes, I believe so. I believe that's the case, but that is an old syllabus, mind you, and we are getting a new teacher. I want to warn everybody. So please don't kill me if it's different, because it could be anything else. And then there was some other thing in there, like a teaching paper, and I was like, oh, great, Scott, that's the last thing we need is another paper. But there's one of those in there too. So. And then also being able to diagram out EKGs and ABGs. So those are also important. Those were the clinical activities. And also, I believe, knowing IV transfusions, how to care for them, blood transfusions. Those were all in the syllabus, all important things to know. Is there any math that anybody wants to go over today, or do we want to check that and reserve it for another day?
I have one question for Matt.
Sure.
Yeah, so I'll show you.
Oh, by all means.
Maybe it'll be hard to see.
Let me get my glasses now. The magnifying glass.
So this is, so it's number 1. Do you see that?
Is this from our book? Is this from our
you know what? It's, I can show, I'll tell you where it is. So in the ADN manual.
Oh, great.
It's in there. It is on page 108, number 1.
Of course, I don't have page numbers on mine. That's lovely.
Oh, if you go
if
you go on the nursing website on ABC, they actually have a link to it.
Okay.
Maybe I'll put the link in the chat box.
That would
Hold on.
actually save me about 8 pounds of time if you would,
Yeah.
because I have it printed out, but unfortunately it doesn't have page numbers.
Yeah, mine is also scrambled.
Okay, good. I'm not alone. I think I experienced this. I think we
Yeah.
experienced this in class actually, and I kept leaning over at Lindsay, and I'm like, "What page? Where?" I think she wanted to punch me in the face by the time we got out of that semester. 5 weeks to me, and she was done.
What page?
It's 108. Hold on, I'm trying to find the.
Yeah. And while we're
link.
waiting, is there any other questions or anything else? Because like I said, I don't know. It gave us a few extra minutes, but in case it cuts us off, this will just be a short meeting for today, because I know we're all going to hit the books and actually get something, read and have a lot more to go next round. But at least we all got to talk and communicate about it the first time. So it feels good to get that out in the open and get some stuff on the table. Is there anything else that anybody else wants to say in case we end up getting cut off somewhere in here?
Yes, I would like to add, I was going to share a few resources that I found that I think are pretty cool, like flashcards, books and stuff, something on maternity that I also found. So if you guys would like those resources, like links and stuff, and everything that I found, you can go ahead and email me. So, you can just go into your ADC email, type my name, it'll come up. It's the one that has the number 2, not the other one in case it shows up. So just wanted to put that out there if you guys wanted that. You can go ahead and email me.
Thank you,
and say,
Letty.
can I get those resources? And I'll go ahead and send them to you.
Thank you. I appreciate that.
Yeah, thank you so much, Letty. You've been a lifesaver through a lot of this. Thank you.
No problem.
And all of you guys, thank you so much, because you've all had so much to contribute. You guys are all super brilliant, and I just appreciate you all being here and being a part of this and making it happen. It would be a really, really boring study session to be completely by myself. Like, well, I'm going to sit here and talk.
What number was it again on 108? I'll work it out.
It's number 1. So I'm trying to expand the Zoom, but I'm having trouble trying to figure out how to do it.
I understand your pain. Zoom and me.
Yeah, because I want to put in the
Jonah
chat.
and I were like, Zoom, no.
Oh, okay. I think I got it. Okay, yeah, I got it.
If you read me the problem, if you could just read it to me if you like.
Yeah. Oh, I actually found the link, so I'm gonna put in the chat box.
That's perfect.
Yeah.
I will go over to chat now. Wait, what?
1 second.
Sorry.
I'm gonna.
My chat's doing things that are weird. Forgive me.
Oh, it's okay. Oh, that's why, because I had to stop sharing.
Oh, that
Yeah.
makes sense.
Okay, yeah. So if you click on the link, it will take you to the manual, and then it's on page 108, number 1. So my answer, I was way off. I got 0.72 milliliters, so I'll write it down in the chat box. The answer is 43.1 milliliters.
You said 108, correct?
0. It's in the chat box. So, and then I'll put the answer too.
Page 108.
You said number 1, right?
Mm-hmm.
Okay.
So drug X is to be started at 8 micrograms per kilogram per minute IV on a 158-pound patient. The drop factor is 15 drops per milliliter. The drug concentration is 400 milligrams per 500 milliliters of 5% D/W. What is the infusion rate in milliliters per hour? Okay, so we're looking for milliliters per hour. Oh boy, I'm gonna need like 80 notes. It's kind of fun I'm trying to am I even still on? What is happening here? Okay, here we go. So that was your answer, and then that's all right.
I'll show my work.
For sure. And let me go back and reread the question. So the infusion rate in milliliters per hour, we have ml. So first we always start off by looking for milliliters. I know I'm probably stating the obvious, so forgive me. And I would say drug concentration. If anybody else has anything they want to interject, by all means, feel free. The drug concentration is 400, and we are supposed to be doing 8 micrograms per kilo. Okay, yeah.
The answer
The
is
drug concentration is just like extra, so we should be putting 1 milliliter over 15 drops. Am I right, Jennifer?
the answer is 43.1, correct?
Mm-hmm.
Okay, so how I do it, if it's helpful,
Sure.
is I put milliliters per hour and then just a line separating. This is what I'm looking for.
Mm-hmm.
And then I start with the top number always, like even if I have to flip it later. So the first thing I'm going to look for is what is given, that's 500 milliliters. And that's the 400 milligrams per 500 milliliters. So I'm going to start with that.
Mhm.
And then cancel milligrams with milligrams and micrograms, because we don't have another milligram given.
Yeah,
We
that's what
have 8 micrograms per kilogram per minute.
Mm-hmm.
So you'll have 500 over 400 and then 1 over 1,000.
Mhm.
Now we need to cancel micrograms, which is your 8 over a kilogram.
Mhm.
And then you do kilogram and pound is the 1 and 2.2. Plug in your patient weight of 158 pounds over 1 minute.
Oh, yeah. I just
Because
realized I
that's
didn't do
8 micrograms per kilogram per minute.
Okay.
that. Mm-hmm. Yeah.
Cancel the minutes to make it hours, so 60 minutes in an hour, and that'll get you
Right.
canceled.
Yeah, I forgot to put 158 over, I didn't put 1 minute. That's why I didn't get the right answer. Oh, okay, yeah,
Oh.
thank you.
Yep,
Perfect.
you're good.
Thank you so much, Jennifer. I appreciate that greatly.
Yeah.
You know what might be a good idea for I know this is our first rodeo, so I was like, how on earth are we gonna do math? Seriously. If you guys want, what we could do is by say Thursday, if we have any math questions, email each other the math questions.
Mm-hmm.
If you guys want, and then we can all take a look at them. Or Wednesday, whatever you guys want. What do you guys think about that?
Oh, okay. I'm sorry, can you repeat that?
Oh, what I just said?
Mm-hmm.
Or Jennifer's thing?
So you said, do you want to go over math problems on Wednesday?
Oh, no. I'm sorry. Let me make it clear. Like, I would say, like, when we're going through the week, if you run into a math problem that you're like, you know what, I really want to discuss this as a group, then is everybody okay with everybody having each other's email that's in here right now?
Yeah.
Yeah, no problem.
Okay, good.
Yeah.
Okay, then all right, because I didn't want to start blasting anybody's emails without, yay, Nick, it's good to see you.
Yeah.
So, yeah, okay, so then we can all send each other that stuff, and then if anybody else, wants to join in, if anybody has any math problems that they'd like to go over, then we can send them to each other by, like, say, Wednesday, and then have them, like, maybe prepared already, like, solved out. Do you know what I mean? Versus like I could hold up a sheet of paper, like, here's what it looks like. Or if I don't know it, then Jennifer can be like, here's what it looks like. Or if we don't know, whoever knows it, Letty can do it. Whoever knows it, you know what I'm saying, can just post it up and say, here's what it looks like. Here's how to solve it. And that would save us some quick time. And we could be able to get those math problems done a little bit faster. And it would give us a little bit of practice on that math too, before we hit today. Does that sound good to everybody else?
Yeah,
That sounds
that sounds good.
Okay. Because I'm like, gosh, trying to squeeze this whiteboard in the screen, like, that's going to be an interesting endeavor. Trying to do that. Like, I don't know how to use whiteboard on Zoom, so we're all screwed on that. I tell you right now. So, okay. So does that?
Did y'all do math in your clinicals, like online clinicals?
What was that?
Did you?
Oh, did we do math? No, we didn't.
So am I the only one that had Parkinson for clinicals?
I had Parkinson.
Oh, you did? Okay.
Oh, that's right. Yeah.
I also had Parkinson.
Like,
Okay,
we did
okay.
math, but not like
yeah,
like an
We did
extent of
it. But it took a really long time. So the taking picture thing, or even texting, I don't even care. Like, just I'll take a picture of it and text or something.
Oh, that's a good idea. Yeah.
Works better because it took a long time to do it on Zoom. It wasn't
Like what we're going through right now, where it's like, and then all of a sudden you're sitting there for like hours doing math. Yeah, like let's find a way that works to expedite it. And it's okay. Like I said, this is, gosh, I'm no expert at running a Zoom session, study group online. So if we have to change a few things and it's hit a couple rocks along the way, that's fine. So Jennifer, you suggest texting or emailing or screenshotting it, something like that,
Yeah,
a picture of it. That's a great idea.
I'll put my phone number in here because I really don't care. Y'all can text me over. Oh shit, that is not correct. Sorry.
We can translate. Let me get my whiteboard so I can write it down. Because if you see me trying to use my Android, I'm like, oh yeah, please. It takes me forever to figure out how to get that thing to work. I need to get out of the dinosaur era. Sorry.
Even if you have like a random question and you just are like, hey, what's the luteinizing hormone called? I don't know. And you're like, yeah, it's luteinizing hormone. You can text me because I might even be like, even if I'm not studying or whatever, I will either know it and send it or need to also look it up. So you can totally just bombard.
Thank you.
Okay, thanks.
I have everybody's shared. Do you guys want to start a group chat?
Yeah, we could do that.
Oh, yeah.
What was that? Oh, a group chat. Yeah, that's brilliant. Yeah. And
that's okay. I mean, I know there's some people that don't really like group chats.
Is everybody okay with the group chat? Type yes if you're okay, other than the people that have already given verbal affirmation. Okay. Okay. Is anybody not okay? Write not okay if you're not okay. No, everybody's okay with it. All right, cool. Oh, wait, put your numbers. Okay, you guys, I will have to email you my number because if I put my number, I will be spammed by the entire universe. So it's a problem I have. Okay, yeah, there was something I was going to say, and it just flew right out of my brain.
About math?
Probably. It's probably why it flew right out of my brain. My brain's like, no, not today. No. Something about what you had said, Jen. Oh, well. What would anybody else like to contribute in case it cuts us off?
So I really like Nursing SOS, that YouTube channel, and she mentions really important things like how to study more, like how to study smarter, not harder. So what she said was when you're studying pharmacology, you should there is a section in the drug book and it's classifications. So where it groups all drugs that are similar together. So rather than studying each drug individually, study drugs within the same drug class. So there's drugs that are beta blockers, like they all fall under lowering blood pressure, and then there's the there's the anti-diabetic, anti-seizure, and they all have the same mechanism of action. And so study the mechanism of action of the drug class. And then when you know the mechanism of action, you can actually also know through that you can also know the the side effects too.
Yeah.
She said, she mentioned that, and then she also mentioned when it comes to Med-Surg, you should study the pathophysiology first, and because when you know the pathophysiology, you can know everything else about it. Also, like you'll know the signs and symptoms. Like for coronary artery disease, if you know, because it's caused by atherosclerosis, which is when there's plaque in the blood vessels, you'll know the signs and symptoms too, because you'll know okay, this person will probably have a rapid, maybe have the tachycardia, because the blood is trying to, the heart is trying to get the blood through to the cells, but there's plaque blocking the artery, so it makes it harder. Perfect. So, and then she also mentioned that for Med-Surg, she said focus on these 3 main topics for each disorder, and they are the common signs and symptoms, what you need to assess for, and the nursing interventions you will do, including patient education. Yeah, and I will link the study guide in the description, in the chat box, so you can check it out.
Thank you so much. Thank you. Yeah, that's actually really helpful. And that was one of the things I really liked about that Doenji's care plan book, guys. I don't know what yours looks like. I wish I did. But the one that I have is great because it goes into that whole pathophys, kind of bullet pointed out, and what it's all related to and stuff. And I completely agree with you. That's a brilliant strategy and way to go about it. Another thing about the drugs, one thing I wanted to bring up, Professor Dickinson is the one who told me that we need to know the peak and the trough. So that is why I created that sheet for you guys. So just a big sheet, so when you're going through, obviously we can't learn every single drug, but just the ones that you find that strike you as the main drugs that are the most important drugs that we're going to need to know. Like obviously they've said digoxin and furosemide like 8,000 times.
Yeah.
We don't know if those we're gonna get punched, so we're gonna need to know those. And then at some point in time, I know Mikey plans on coming on, and I know my mom. She's I don't know if she's available, but she can probably definitely answer questions. She's actually an ER nurse and has been for over 8 years. So
Wow.
yeah, so she can give us like a lot of tips and advice and stuff like that. So
That'd be great.
yeah, I'm not sure when she, unfortunately, I think she works on Friday nights. I was like, great. Way to go, Jack. But we can always she can always like make a video answering all of our questions or something like that. And she told me she'd be more than willing to give any advice that, and any hope as well. So, and like I said, we can always, pester our other professors too, and once they get bored in the middle of summer, and be like, so feel like jumping on and talking about lungs today or hearts today. But yeah, I don't know. Hopefully this is helpful for everybody. If it's not, then by all means feel free to shoot an email and say this needs improvement in this fashion. But hopefully this is working for everybody in this way. Good so far for the most part? Okay. Okay. Does anybody else have anything else they'd like to talk about? Any other questions?
Good for tonight. I think I'm going to go over some things y'all gave.
Yeah.
We don't have anything else better to do than study.
I swear.
COVID.
I know, right?
Yeah, it's the intro to the big one. But I saved the last 2 weeks if you guys are interested for pharmacology and just applying all of that. So we'll kind of go through everything for the next 8 weeks, and then the last 2 weeks is kind of a free for all of apply whatever we've learned, however we can, make it fun, make it interesting. You know what I mean? Does that sound good?
Did all y'all get Med-Surg first, or
Yes.
No.
I
actually
got
didn't.
OB first.
Yeah, I got OB too.
OB first. Me too.
Who's got OB first and who's got Med-Surg first?
I have OB first because I found out that OB is easier than Med-Surg, so I want to get the easy one out of the way.
Okay.
Which one did you get into?
Oh, which one? Let me check. I don't remember exactly.
I got Monday, Tuesday, Wednesday class with I think Corbett.
Okay.
Jen, are you in Med-Surg?
By the way,
Yeah.
getting classes was like super stressful because I was literally the last person to get the spots in the classes I wanted to get. Like there was like space left, and I got them.
Oh, wow.
That's nerve-wracking.
Yes. Oh my God, I had anxiety for days afterwards.
Awesome. So Jen, you're Monday, Tuesday, Wednesday as well then, right?
I am actually Monday, Thursday, Friday.
Oh, okay. Then I'll only see you in lectures.
Yeah, I got Monday, Tuesday, Wednesday one filled up really fast.
Oh my gosh, I think I could not believe it because like all the LVNs had swooped in and they got them, and so there was like nothing left at all. I was scared that I even got one, but yeah, I know.
Is there priority registration for nursing classes?
No, there isn't.
Oh.
It
Oh,
was
okay.
whenever they were released. It was the weirdest thing ever, to be honest with you. We have to be careful because this is going on YouTube, but the whole situation was strange. And there were like a lot of spots missing. But I will say this much. Even though we might not all be in the same classes, I still plan on Friday nights at this time doing this, whether you guys can make it or not. And I still plan on uploading them throughout the semester, next semester. So for those of you who are stuck in OB, first round, have no fear. We're still going to be here. But it's going to be open to everybody. It's open to all semesters. So newbies coming in from Nursing 101 who want to ask questions on Friday, they're more than welcome as well. People from third and fourth semester who know more than me by far, they're more than welcome as well. So it's going to just be a free-for-all from here on out, Fridays at 8, and whatever we do gets posted. So, you know, throughout the semester, I plan on doing that, just so everybody's aware. So if you miss something or, you know, you're curious as to what might be going on, you can just, even if you don't even show up, you can go watch the YouTube link and take a peek if it's, you know, something that interests you. So.
Yeah, I was gonna say, so my schedule is actually like for maternal and newborn nursing. It's Monday, Tuesday, Wednesday, Friday with Elizabeth and Mary.
Okay.
Yeah.
Yeah, so
Hi,
I was thinking, you know, like Jack said, we could still meet every Friday and kind of tell each other what we did each day. So that way, when, you know, the people from OB go to Med-Surg and vice versa, we can, you know, already know what to expect.
Yeah, that would be really helpful.
Yeah, and so it'll be great. And then you guys will be able to share with us what's going on in maternity, because that's the other thing. I am not going to be running a maternity session. First of all, I ran out of time, which I think is kind of obvious. And then second of all, I went, I'm probably the wrong person to be running this. So if anybody wants to run a specialized study group for that, I'll be more than happy to either participate or watch your videos. But I was like, yeah, I don't think y'all want me sitting here talking about the birds and the bees for the next, you know, however many hours. Just give me whatever.
I want to also say that, so is the YouTube channel that you have, is that private?
That's mine, yes.
Oh, okay, good, because, yeah.
Well, it's not private, it's public. It's public for all to see.
Because if the nursing instructors find out that I feel like, wouldn't that be a problem if, like, they find out that you're posting public Zoom sessions?
You could also make it private so that only a few emails have access to the YouTube videos. For example, only the class that we were in.
Well, there's absolutely nothing wrong with discussing what we're discussing. This is just a study group session that could be available. We can privatize this if we need to, but I will be posting other public videos for other people, because the thing is it's like, if we do it, whatever we're discussing is going to be helpful for everybody. But it but we could talk about that for sure. That was what I was saying. That was why I made that speech in the very beginning, where I was like, is everybody okay with this being posted on YouTube public?
Yeah, I think it would be a problem, like, if we start, like, saying, okay, this is what happened in our Med-Surg class today, and like posting that on YouTube. I would feel like that would be a issue.
Yes, I think that would be bad. I think the thing to discuss would be what we're learning and what's important to know, like what we're doing now, basically just a study group. So it's not, like, for example, when I plan on posting some videos for 101 and saying, okay, here's the Taylor text, here's some stuff that you're going to want to really know before you get to that class. You're going to want to look at this, you're going to want to look at that, you're going to, stuff like that. So we're going to keep it in a study group session, not like anything other than that. Does that make sense?
And like, if for those private recordings, we can just send it through, like, we can share it through Google Drive so that it's private.
Okay. We're still recording right now. Is everybody okay with this recording going on?
Oh, yeah.
Everybody that it would, are you sure?
Yes.
It is public to the universe. Like,
Hello, universe.
Are you guys okay with that?
Hello, universe.
Hello, universe. Is everybody okay with that?
Yes.
If you're not, then
hello, aliens.
Oh gosh.
We forgot to say Elon Musk.
Don't bring that up.
We missed the SpaceX launch, you guys. This could have went up. I'm just kidding. But now that would be a great person to have on here is Elon Musk. Okay, now I'm
What, an alien?
Huh?
You want to have an alien on here? Is that what you're saying?
No, Elon
Elon
Musk.
Oh,
Okay, but
I was like, okay, Jack.
Elon Musk, creator of the whole entire situation that just happened, the SpaceX launch with NASA and the Dragon and the whole 9 yards, and about 1,000 other things in the Tesla car.
Yeah.
the genius of all geniuses. I'm like, we could totally have him on here as a guest. I'd be happy.
Oh, yeah.
Just ventilators out of car parts. I'm down.
I mean, if you have advice, totally.
Does anybody else have anything else they want to say or anything else they want to add?
No, I mean, not really.
Yeah,
I
I'm
mean,
not.
just reminding people like about the resources. Some of it was going to be what Sione had said earlier, you know, like about pharmacology stuff and what to focus on in patho and everything.
Yeah.
So I'm, you know, just going to reiterate some of that in my email. So thank you, Sione, for bringing that up.
Yes, thank you.
You're welcome.
And then I put in the comments, I'm also gonna, I came upon a list of 30 common drugs, which include individual drugs and classes of drugs to know for the NCLEX. So, you know, I'm gonna link that to you guys, and then you can keep a lookout for those when and if they come up, you know, throughout our nursing school experience. So.
Are you going to send us information through ABC email?
Yes, it's going to be through
Oh,
the
okay.
ABC email. So people can just email me to my ABC email, which is, I'll put it in the chat box.
Well, you might want to wait until I end the session. Do you want me to end the session? Is everybody ready for that to be ended? Because I can end the recording and the session can continue. So
Okay.
let me stop the recording.
If you type my name, if you type my name into the ABC email, my email will come up on there.
Do you want me to stop?
Oh, yeah.
I can stop recording right now so you guys can actually exchange that. Does that sound good?
Yeah, that's fine.
Okay. All right. I'm gonna stop recording and then hopefully did it stop?